Hey everybody, this is Dr. Josh Funk. I am back with part 2 of our series on clinical rotations, internships, and the path to the profession. In part 1, I was sitting down with Dr. Baker and Dr. Iannarino, and we were really deep diving into what makes a good internship program, systems and processes behind it, the why of having high school to college to DPT interns. And then really what we're going to get into with this particular episode is things that we've seen that will allow you to ideally implement an internship program that will be successful and to make sure that the interns that spend time with you will have an amazing experience. So we're actually going to hear from Zach first. Zach has been pretty much our right-hand man with regards to setting up the internship program and really putting us in a situation where we feel like we're getting tons of 5-star reviews from our students. But Zach, talk to us a little bit, particularly about the interview process, because much like anything, when it comes to employment or internships, I think a mutual fit is something that is extremely important. So talk to the listeners a little bit about that.
I would agree. And I'll start this off by saying our process of selecting and actually obtaining students has evolved over the last few years as we've gone through the design of our internship program. And as we've gotten more contracts with more schools, we have a larger pool of applicants that we have to choose from. So I would say we've always done a very good job of making sure we're getting people into our clinic that are a good fit for the clinic, meaning we are an outpatient sports ortho clinic. So we want to have people that ideally have a desire to get into that field. And we also want to have students that we can make sure that we are making the most of their time while they're here. So we started to implement an interview process, I want to say about a year and a half to 2 years ago. Originally, it was something that myself and Anthony were spearheading. And during that process, we really just tried to get a good idea of what was this applicant looking to get out of their experience. We wanted to avoid the situation of somebody just seeing rehab to perform as an option on one of their clinical site lists and randomly being put there. And we wanted to prioritize the people that were trying to develop their niche in the sports orthopedic world. I think another little wrinkle that we added to that interview process was we started to put the interview responsibility into the hands of the clinical instructor that was going to take that student. And I think what we found was myself and Anthony were leading these interviews, and there were people that I thought would be a great fit and a great match. And then I would be placing them, or Anthony would be placing them into different locations with each different clinician that we have. And there were certain things that they were picking up on that we weren't. So to give our clinicians the most enjoyable experience and the best way to prepare for their students, we actually started to let them do the interviews to see if they think that the person's going to be a good fit for them or not. And I would say having this interview process in hand has really helped us target and attract the appropriate people, and also matching them up with the clinical instructor who's going to give them the best experience.
And Zach, on that note, I mean, somehow we had this guy from the University of Dayton just get through our interview process, and he actually became our first intern. And some things that you would recommend for students out there who are really, really looking to make a good impression through an interview process like this.
Yeah, Josh, I was just happy to slip through the cracks and end up on the clinical. But some of the big tips for the interview process is, I think authenticity is a big word that we talk about with all of our clinicians. Just that's something you really can't replicate and create and fake. So one of the big things that I see that is one of the qualities of our internship is a lot of people go through, like, it's not the path of least resistance to be here for a lot of people. Like, people are traveling, they're getting, finding housing, they're going out of their way to be here. And I think that quality and that desire kind of self-selects for someone who is going to put the work in and be mentally prepared throughout the 8 to 12 weeks to really get the most out of the experience. So I think just emulating a genuine desire to be in this setting and kind of reflecting that passion and that past experience that's driven you to want to learn and a little bit of understanding about, what we do here and how that fits with, your vision for where you want to be in the future. I think being able to reflect that is one of the strongest things I look for in a internship interview.
Yeah, I mean, I think that's critical, not just the internship, but obviously to the mutual agreement when it comes to employment and working with a team. But once they get past the interview process, Ant, I mean, talk to the listeners a little bit about how things are brought to them with regards to onboarding and with regards to their expectations in that early part of the internship.
Yeah, I think one of the best pivotal moments for CI and student is we like to do a phone call prior to, just to check in to make sure everything's okay. Make sure that they've got through all of the information we send out as far as pre-reading materials, curriculum, just so they're comfortable and have some idea of what things are going to look like before they come in, and give them an opportunity to succeed by seeing some of the materials that they may have not been exposed to, of things that we really rely on and do regularly. And then that first day, having that conversation of, what kind of learner are you? How do you best take feedback? What things are you very comfortable with right now, and what things do you do not feel comfortable with? I think what it does is it sets the tone for an open channel of communication, and it also gets the CI in a situation where they understand the person's strengths a little bit better, so they can set them up in a position to succeed from the start. Overall, this clinical process, I think something that, unfortunately I hear from students is they feel like oftentimes they're just kind of thrown into the fire. It's kind of like sink or swim. It's your last clinical, like, here's a caseload, ready, set, go. And really this experience to give someone the best opportunity it should be periodized, just like we periodize the work with our patients. So we need to set them up in a situation where not only can they succeed and just get the work done, but can they get quality work done and actually have time to reflect on it? Do they have time to, really dissect what's going on, do the research to make the next session better? Or are they just trying to, I got 5 patients in a row. Can I just get the session done and not have, anything bad go on?
And Ant, there, you bring up the word time, and this is where I'll just tag Zach in, because I know that this is something that he has reinforced, not only in myself, but our other clinicians with regards to managing time, obviously managing the priorities of the client or patient that is in front of us as well. So Zach, when it comes to really balancing the expectations of the student, balancing the expectations of our company, and then balancing the expectations of the patient who really wants to come in and have an amazing experience, what are your recommendations?
I think a lot of it goes back to that foundation that Anthony talked about, and you figure out, what is this student trying to get out of this internship experience? What are they comfortable doing? What are they not comfortable doing? What have they been exposed to? What are they hoping for more exposure to? And you take all of that information and you find ways to leverage that into patient care. So you find ways where you take the student's strength and the student's comfort level, and you match that up with periods of time to have them interact with the patient early on in very low risk environments. So if you have a student who's very comfortable with exercise prescription and executing different things within the weight room, then you're going to prioritize introducing them to patients. Maybe while you're doing some of the more introductory stuff with the patient, you're triaging the situation, you're developing the plan of care, and then you're then getting the patient into some of their more routine things that they've been introduced to before. Maybe you bring the student in to help out with that point because it's something the patient's familiar with, it's something the student's familiar with. And then that allows you a chance to sit back and see, now, how does the student actually interact with this patient? And then you can start making more educated decisions about what is the student going to look like when they're faced with a new question or an unknown environment. Do they handle it well? Are they able to redirect? And I think it's kind of that art of how do you allow yourself as a CI to blend into the situation and promote autonomy, but also know when to step in and just do that tactful redirect if you do need to take control of the situation.
You talk about autonomy there, and I do think that's obviously something that we're trying to create in the schools are trying to make sure that we are allowing for that individual to develop autonomy. But sometimes when people come to our office for a rehab to perform experience, they don't always want to work with a student, or they don't want to spend a ton of time with a student. How do you navigate this, kind of back and forth with regards to making sure that you're putting your student in an environment where they are learning and they're getting to kind of think on their feet and handle things a little bit more independently? And I mean, I can speak back to, our time together. I mean, you being the first student, us going through this delicate balance of reading people and figuring out, hey, is this person actually really okay working with a student? But what are some things that you think are important that, the CI and even the student can pick up on, just to make sure that they're meshing with the patients that are coming through the doors?
Yeah, this isn't always an easy balance to strike. And I think really what it comes down to is situational awareness and open and clear communication. I told my students this other day, we have to be, over communicative. We need to really stress, are we checking in to make sure things are going all right? Are we, paying attention to body language? Me as a CI, am I checking in at the beginning and the end of sessions to show that I'm, present and a part of this plan of care, even though the student is taking control? So really big things we look at is, what is that body language like? How is that student and that patient getting along, and how is their communication? And again, is this person, like Zach said, is this person really in their needs matching the strengths of my student? Or is it something that I need to step in to supplement or buffer things a little bit? And I think at the end of the day, as we are building up those strengths of the student, it's kind of like playing matchmaker to figure out, personality wise and needs wise, who's someone that your student's going to knock out of the park. And then ideally over the course of that clinical, that percentage of people is going up and up and up and up. And there are times where, as a therapist, we're not going to be with people that are perfect personality matches for us. So as a student, that has to be something that you have to be able to navigate. And as a CI, that's something you need to help them navigate. So as comfort level rises, oftentimes we find that our students have a higher probability of success. But like I said, there are times that as a CI, I think you need to, kind of be the thermostat in the room and say, okay, this patient, maybe I haven't given as much attention to in 2 sessions. Maybe I'll take the lead with them because I'm starting to feel something that they're getting a little cool, and they might need a little bit of pick me up, or a little bit of presence of the coordinating therapist to make things sure everything is okay. But like I said, more often than not, as the students grow in confidence, as they grow in their ability to communicate and grow in their just ability to carry themselves as a professional in the clinic, that happens less and less and less. So that's what we're trying to build when we talk about autonomy. It's not something where we say, all right, go out and sink or swim. It's something where we are monitoring and making sure that they're in an environment where they are, number one, safe to fail, because it's going to happen. But number two, giving them the best chance of success.
Yeah, and you talk about the word success there, and I think some of the things that obviously we could probably talk a lot about all of the positive things that we've noticed in students, but unfortunately, sometimes there are also some challenging items. I mean, if I can think of 2 particular big picture topics off the top of my head. One, I'm thinking about the student who shows up right when work starts and shows up or leaves right when the day ends. Somebody that doesn't put in that discretionary effort. And then I'm also thinking of sometimes there are people that get through the interview process and then they still struggle with conversational skills. These are people that maybe would benefit from a hospitality oriented job with regards to, honestly, just customer service, things that aren't even clinically focused. But when we talk about other things that I think that are not really discussed in PT school, 2 words come to mind. One, framing, and the other, forecasting. Zach, with regards to the framing of sessions and the forecasting of future sessions, how this kind of goes with, adherence to plan of care and really having somebody buy into the fact that, there are certain things that need to be done to get to ideal outcomes. What would you say with regards to the words framing and forecasting?
I think you can go a couple different routes with that. And you talked about one of the case scenarios with the student where they come in, right when the day starts, right when the day ends. And I think an easy way, and this goes along that framing theme, is you lead by example as a CI. And our CIs lead by example of what our leadership staff does within the company. And I think when you have an owner of a company and you have people in management positions of a company that have a reputation of being hard workers, of being prepared, of putting in the extra effort before and after hours, that trickles down to the staff. And if you're a student and you're walking into an environment where every single person is showing up 15 to 20 minutes before the day, they are prepared for the day coming up, you're going to feel out of place pretty quickly. And I come to think that that usually corrects itself if you're leading by example. So to piggyback off that, from more of a micro standpoint with regards to framing, something that we try to do with all of our students is we try to give them a good idea of what the day looks like. Hey, here's our schedule. Here's who you're working with. Here's who I will be working with that you may not be directly in contact with, but this is what I would like you to be working on during this time in preparation for later of the day. In regards to framing up sessions, I think it comes down to every time a patient walks in the door, you need to greet them, triage the situation of what has transpired since the last time they were in, how are they doing, what concerns, what questions do they have, and then you lay out right from the bat, hey, I hear what you're telling me. I think it is okay to feel that, or I'm a little concerned that we're feeling that, and this is what we're going to do to address it. And you let them know right from the start what your plan is to accomplish that day in the session, how you're going to accomplish it, and what you forecast, and this happens at the end of the session, of what you forecast to take place between now and the next session, and what your exit strategies are going to be if you meet those goals, or more importantly, if you do not meet those goals. And I've had very few encounters with a patient when you frame and forecast very well that one, you either don't meet those expectations, or it's very rare that you're going to have a less than desirable experience if everybody is well informed and they know what an ideal outcome looks like, but they also know what the game plan is going to be if that outcome is not achieved.
Framing and forecasting. I mean, I could probably talk for much longer than we're going to be able to speak today. But when I think about them, I think about really just making sure that we're able to drive home those clinical outcomes that we're looking for, despite still having a student, right? Like, we are taking our time to really put ourselves in a position where we could be a little bit vulnerable with regards to meeting expectations. I mean, obviously I have a great deal of pride with our company, but we could put ourselves in a situation where we have a student who maybe isn't quite up to par, and that could leave a lasting effect when it comes to, people having potentially negative word of mouth with regards to coming back into the business. So I think that's one of those things where, we have had PTs and especially our site directors take tremendous ownership over that internship program and really holding it to a high level of standards and expectations. And your newer role as the site director, obviously Zach's been doing this for a little bit while longer, but now when it comes to not just mentoring a student, but mentoring your peers who are PTs who now have students, what are some conversations that you find yourself having outside of the ones that we've mentioned so far? And how are you ensuring that, those PTs and the students are having this world-class experience?
Yeah, I think a lot of it's kind of that, coach the coach mentality, right? Where we're looking at, some of the experiences that I've had and learned from Zach and you as CIs, and from my other CIs and qualities that I've really appreciated, and then things that I've found that have worked well and not worked well in that leadership role as a CI, and trying to emulate that to the other, clinical staff members we have who are now taking on students for the first or second times. Because the big thing is, there's a lot of mistakes that I've made and continue to make. And as you go on and do that, your probability of success and your ability to identify problems before they happen should start to sharpen. So really, I think that goal of mentorship is to limit that period of suffering for someone else, right? Is to try to guide them away from some of those failures and struggles that you've had, and try to streamline the process. I think hearing you guys talk about, forecasting and session flow was that checklist is a huge thing. We talked about that checklist manifesto last time we were in, is how do we, systematize something so that early on in a process, we put, guardrails on it, to where, whether it be, making sure we're asking the same questions every session, or for a CI, make sure that we are, auditing a process the same way with a student, or we're onboarding the student the same way, or we're, having weekly check-ins at this time, so that there's less variance and we're, finding ways to catch problems before they become a problem. So helping set up systems that are, company-wide, but also helping set up systems that are clinical instructor-wide and student-wide, so that they can individualize to that best fits their needs, but make sure, like I said, we're setting up those, bumpers in the bowling alley lane, so we have room for variance and growth, but we aren't going to, fall into the bumper and get a gutter ball.
I love that. I mean, yeah, guardrails, and you talk about the bumpers and the bowling lanes. I mean, I think for us, we've done such a good job of not just clinically, but even clerically and operationally, of ensuring that when a problem does occur, we're putting ourselves in a situation where we're not necessarily focused on the person, but we're focused on the framework that person was operating under, and trying to figure out why they potentially might have been led to making that kind of decision. It is not a people problem as much as it should be more of a system and process problem. And the more that we can be solution focused when stuff pops up, the better off that we'll be. And as long as we continue to have that mindset, I think we always put ourselves in a situation too where we're having less emotional conversations that are viewed to be less personal. And instead of, hey, okay, this person was involved in this problem. Okay, it must have been this person. We're looking at is, okay, this person was involved in this problem. How did you come to that solution? And how can we ensure that we have a different outcome or different decision-making process in the future? But Zach, I mean, when I think of, right, three things, and I'll just kind of revert back to something earlier, but we're trying to create autonomy in students. Early, we're trying to make sure that they're really, really good trainers. Second, we're trying to make sure that they're good at the evaluation process. And third, we try to end up in a situation where they're at least competent and entry-level thinkers by the time that they're done with us. What are some things and some pitfalls that you have seen over your time as a CI? I mean, I don't know how many students you've had at this point, but what are some things that you think have been tremendous barriers to growth and to students really making the most of their internship experience?
Those are all very good points. And I think one thing I want to touch on even before all of that, when you talk about how we are making sure that we're having a good experience for the student and that they are improving and progressing through, we talk about these formal systems that we have through the interview process, through an exit interview and a survey process. I think we do a very good job, and we really pride on ourselves on having a very light and enjoyable environment for the students to function in. I think part of the quality control that we do is we have other staff members and other CIs interact with other CI students. I try to make a point when I don't have a student, if I see one of the students who doesn't have a very busy part in their day, I'll steal them. I'll have them help me out with the session. It's an easy way for me to pick their brain and have conversations with them that I think the CI should have already had a conversation with. And judging on the answers and responses and how readily that person can jump into the session with me is a very easy, informal way of quality control from a site director and from an overall big picture standpoint. When we talk about developing autonomy, we talk about meeting goals, creating these competent and confident clinicians, there are some common pitfalls that you see. I think the very first one that I see is students who are afraid to communicate what they are uncomfortable with, or students who are unable to clearly define what they want to get out of the experience. And I can give you a perfect example of that. I had back-to-back students who were both from the same school. They were both from University of Miami. They were both in their final 2 clinical rotations. Their needs from a curricular standpoint was to be entry level. I had one student who had a phenomenal experience prior, and they had been exposed to a variety of things, but it was something where they only got to interact with 3 or 4 patients a day because of the clinic they were at. It was just a big barrier getting students to interact with some of these patients. So they told me, Zach, I'm comfortable treating knees. I'm comfortable treating shoulders and backs. I don't know what it's like to actually manage a morning by myself and have to come in, plan for a day, treat 5 consecutive people, and then still be able to keep my cool and go into the afternoon under control. I have other people that say, look, I've been thrown to the wolves, like Ant said earlier, and I've seen 18 people in a day, but I've never seen a cervical radiculopathy, or I've never seen an end-stage post-op ACL. And I think having these open conversations early with the students, and really just, you got to poke and you got to pry as a CI. And if you're not getting the answers you think you need, you have to keep digging a little bit more to figure out what is going to make this student an entry level and high functioning clinician when they leave here.
Yeah, I mean, I think some of that's going to be formal. Some of that's going to be informal. I mean, one of the things that we haven't mentioned outside of the daily schedule that they're working off with their CI, the PT that they're working with, is we have an hour block each week for the PT, the CI, and their student. This is something that I think everybody kind of structures a little bit differently, but on the big picture level, a lot the same. And with regards to this hour where you're spending time with this student, you're looking back on the week, you're making sure that we're going through kind of these checks and balances. You're trying to guide their critical thinking development as opposed to telling them what exactly to think. What are some recommendations you have for a CI in an environment where they do get to carve out some time to spend with their student?
Sure. I think, and this is something like I used the word periodization before, and I think this type of meeting and in this time slot, I try to periodize it in a way that's going to help set up the flow and the trajectory of the clinical in a way that I'd like to see it go, and that the student needs it to go based on their individual needs. So what I'll typically do is I'll have kind of a more formal setup for my first 3 or 4 weeks where, maybe, first week I'm talking about just overall clinical philosophy and trying to get them an idea of, how I'm thinking about things, so that when I'm doing an evaluation and they're watching and observing, they get a little bit better idea of, where I'm coming from and maybe where some of my biases lie. And maybe, what some of my, influences have been as well, so that they can, research that and ask better questions to understand a little bit more about it. And that really just sets a foundation for them to ask better questions, to have a little bit understanding, and us to kind of speak a common language from the beginning. From there, we'll dive into the X's and O's of the evaluation process. We'll do a full hour on patient communication. And then from that point on, and once we hit those big rocks, it becomes something where, whether it could be me identifying some areas where the student needs to improve, or like Zach was saying, some place that they are expressing they haven't been exposed to, and ideally later on, it's that student kind of taking the steering wheel and saying, hey, I'd like to talk about A, B, and C. I don't feel comfortable with X. And then it becomes something where it just becomes a formal time for us to dissect and go through case studies where we're, maybe in a busy day, we're not able to sit down and talk through some of our people, and we're able to deep dive some of these concepts. And really the conversation becomes a little more organic at that point, because it's not, something where like, today we're going to talk about shoulders. Today we're going to talk about, Betty Jo's shoulder and what you did, and maybe what I may have done differently, or, what you did well, and some things that we can look for in the future to help forecast. So it becomes real, it becomes live, actionable, playable, and things that we can retest as we go through the process. So I love what you said, is it's a little bit different for every CI, and really within, myself, I can say it's really different within every student. But having that foundation and having, goals that you're looking to get out of it, and then individualizing based off of needs, I think is really the best way to go forward, and my best advice for that.
A needs analysis, man, that sounds just like a parallel for patient care. So
it really is.
Yeah. I'm going to wrap up today just with a little bit of more of a direct statement, especially to the PT students that are listening. You all, right? Each of you should make sure that you're doing everything that you can to put yourself in a situation where the company that you're going to go spend time at and the CI who you are spending time with is setting aside time for your development. Ask whether or not you're just going to be thrown into the fire, and choose not to go to places where time and time again, that company is just putting you to work. Yes, what you do at every single place is going to look a little bit like work, because it needs to look a little bit more like you're an independent PT and you're showing up to work every week. But if you have a place that is not setting aside time for your development, and you have a person who you're supposed to be spending time with who is not investing in you during your time there, choose another place. The way that we can continue to make sure that clinical rotations are doing what they should be doing is to ask these questions, to hold high standards, and to some of these places that are not doing right by students, don't go to them. I'm just going to close with that statement. I know it's a little bit more direct, but it's feedback that we get time and time again. You all are valuable. You're in a situation where you're in the prime with regards to developing yourself and putting yourself in an ideal job and ideally a great position for your future. That final year or maybe second year of PT school should be a really, really fun and enjoyable time period where you get to learn a ton, and ideally you leave that experience a much better clinician and hopefully even a little bit a better person. So I'm just going to wrap with that. Zach and Ant, thank you so much for your time. We would love to hear feedback on this episode, and also would love to hear some questions or future topics from the listeners. So don't hesitate to reach out either on Instagram at R2P Academy or one of our individual accounts. And don't hesitate to reach out on other platforms as well. But thanks, everybody. We will be back with something from me for the next episode. It'll be focused a little bit more on just the PT profession as a whole and what I feel like PT 2.0 should look like. Stay tuned.